Hi, and welcome to 10 Kids, 2 Docs, Parenting Insights from Pediatrician Moms. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. Welcome back.
So there was a collective memory of infectious diseases that because of the vaccines, we've completely eliminated over 30 years. So current parents have no concept at all of the impact of the diseases on the kids.
That is Dr. Scott Krugman. He is a fellow Johns Hopkins-trained pediatrician, and he's the dean of a regional medical school campus with the George Washington University School of Medicine. His passion for teaching about vaccine-preventable illnesses became abundantly evident when his Facebook posts about diphtheria, pertussis, polio, measles, etc. reached 10 to 15 million views each. So we are super excited to hear from him today and to have the pleasure of interviewing him. We hope you enjoy this two-part series on vaccines with Dr. Krugman.
Today, I want to start our discussion with two very aggressive bacterial illnesses, and those are invasive Haemophilus influenza type B, which is covered by the Hib vaccine, and streptococcal pneumoniae, which is covered by the Prevnar vaccine. Both of these vaccines are given in infancy.
Let's jump in.
Welcome to the 10 Kids, 2 Docs podcast. Seasoned pediatricians and longtime friends, Sylvia Bank and Vivian Carlin have counseled thousands of parents and are raising 4 and 6 kids, respectively. Join these doctor moms as they incorporate fun and their combined wisdom and experience to share parenting insights for anyone looking for practical and trustworthy guidance. Please note that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your doctor.
When I have a discussion with parents in general about vaccines, and I'm going to pick one of the vaccines to talk about, I often start with Hib because nobody knows what Hib is, yet they're familiar with that term because it's given in infancy. They've often heard of measles, but they have no idea what Hib is. And I feel like over the course of my career, I can make the starkest contrast between how physicians one generation before me practiced in the ER and how I've practiced in the ER because of the Hib vaccine, which was before my training. It was right around 1990 when it became widely available.
Yeah, so I can make it by not even a generation. Like my senior residents had a different experience than me, right? Like literally, it was right in that transition where, like 5 years before starting residency, every single child with a fever was at risk for meningitis, buccal cellulitis, epiglottitis, horrible diseases that cause long-term problems and or death. And literally every ER had multiple protocols in place for epiglottitis, right? There was the STAT team where anesthesia, ENT, you didn't like disrupt the child at all. You had to have all of these things in place so the child's airway didn't close and then die, right? And that was like drills. Everyone did that regularly.
And let me make a side comment here for listeners. So the epiglottis is the flap that covers the trachea. Like if you can envision when you're swallowing food, the epiglottis comes down, covers the trachea so food doesn't go into the windpipe, right? Down towards the lungs. If you can imagine, Hib was notorious for causing that piece of tissue to swell to the point that it was always blocking the trachea. So children would come in significantly distressed, using every ounce of their being just to try to breathe. And, in most scenarios, when we have a child like that, we put in a tube. Lots of people are familiar with that. We intubate them to help breathe for them, right? We take over that airway for them. This is very high risk because that piece of tissue is right in your way, right? Like if you're trying to put in the tube, you're even being thwarted in that way with your best treatment. So This is like terrifying lore of the doctors in the 80s, right? I've heard this so many times. And people don't even know about this anymore.
Yeah, this bacteria is notorious to start in the respiratory system, get into the bloodstream, and stick somewhere. And it sticks around the brain, it sticks around the epiglottis, it sticks on skin, it can stick on bones and joints. It could stick anywhere. And the younger kids are at the higher risk, and that's the reason it started as a 2-4-6 vaccine, right? And the reason why delaying vaccines doesn't make any sense because you don't want to delay this vaccine. You want to get this one in when our kids are at most risk. Right. But literally overnight, the protocols changed and Hib disappeared. And I did not see a case in my entire residency. They went from like my chief resident taking care of it to me not seeing any case. That's how impactful this vaccine was.
Yeah.
And again, it was hidden because the only parents who would know about it were the parents whose kids got sick with it. But what we found was the number of kids in the hospital went down substantially. The number of kids with fevers went down substantially. The number of kids with needing lumbar punctures and things went down. And all the protocols around infections around the eye, periorbital cellulitis is the fancy word for it. All those kids used to all get lumbar punctures and CAT scans and antibiotics. We changed that protocol. We stopped doing lumbar punctures on them because none of them had Hib anymore. So it was really dramatic.
But literally overnight, the protocols changed and it disappeared. That was what Dr. Krugman said concerning Hib. The practice of medicine is based not only on clinical judgment, but also on this assessment of risk. So I want you to imagine when a child comes into the ER with a fever, I, as the clinician, am running in my mind a statistical analysis of risk. What is the risk that this child who has fever actually is harboring some serious life-threatening infection such as meningitis? So Hib meningitis occurs when the bacteria gets into the spinal fluid that is all around the brain. The bacteria then multiplies in that fluid and causes a rapid deterioration in the child's health. So rapid that there is often not enough time for us to treat, even in the best of circumstances.
When the vaccine became available, Hib was the leading cause of bacterial meningitis in young children. It had quite a high mortality rate, and for those children that did survive Hib meningitis, there was a high rate of complications that were permanent, such as deafness, blindness, or other neurologic damage.
See, like, for example, you may have heard grandparents in our generation speak with fear about ear infections, this idea that if an ear infection went untreated, it was very risky because it could lead to meningitis. Well, that was actually true because Hib caused a lot of ear infection and it could actually develop into meningitis if left untreated. Those protocols changed because kids coming into the ER with fever weren't at risk of this serious type of meningitis like they were the decade prior. Mm-hmm. As soon as the vaccine became widely used, it's that effective that it puts a stop to it almost immediately. So, of course, there were many other bad infections that Dr. Krugman mentioned in that discussion we just had with him. All of them end with itis, and all of them involve different parts of the body. And we could go through all of those, but sufficeth it to say they're all bad, they can all be deadly, and they are all 100% preventable with the Hib vaccine.
In the early 2000s, we added the Prevnar vaccine, again for the streptococcal pneumoniae bacteria, which further dropped the rate of childhood meningitis and hospitalization.
And I am, unfortunately, old enough to actually have witnessed some of that transition because I definitely remember, and, we'll never forget it, taking care of a child in the hospital with strep pneumococcal meningitis. Like, healthy child who all of a sudden gets sick and in a matter of hours is deathly sick. It strikes fear. That diagnosis strikes fear in us. We don't think about it that way anymore because of the vaccine. But yes, let's talk about Prevnar for a little bit.
Yeah, so pneumococcal bacteria is really an interesting one. And where it was such a big deal for us as trainees in the 90s was around the fever guidelines, right? Because it's one of the bacteria with Hib that can cause occult bacteremia. So it can be circulating around your kid's bloodstream, and they can be looking at you, having fun, being perfectly fine. But like you said, a few hours later, if it sticks somewhere, like around the brain, all of a sudden it's stuck in a contained environment, starts growing, and you have fulminant meningitis and sepsis and near death pretty darn quick. And because of that, like we mentioned, many kids, literally every kid who showed up in the ER with a temperature above 102.5 was getting blood work and antibiotics and coming back the next day and getting another dose of antibiotics potentially. And that was a big deal.
Yeah, and I feel like that scenario is a parent's worst nightmare, where your child has a fever, you're worried as a parent, and then without action, or if action wasn't taken, then there's an immediate plummet in the condition of your child to the point where they're needing like life support in the ICU, right? And that is every parent's worst nightmare. One of the things that I remember from my training, I remember being called down to the ER. I was on one of the general pediatric ward services. And, we're listening to the story of this, 1-year-old that had come in with fever. And this child needed to have a spinal tap. And we tapped this child, and instantly, even before the culture, they kind of look at the cerebral spinal fluid under the microscope, and they saw gram-positive cocci. They saw streptococcus in the stain. And
Yeah,
that child,
this is Prevnar,
right, that
streptococcus.
child was immediately sent to the pediatric intensive care unit. Prevnar had been released, as a vaccine, but it wasn't part of the regular schedule yet. And these parents were given the option of having
Mm,
the Prevnar vaccine. And because it was new and they were unsure, they declined getting the Prevnar vaccine. So the child went up to the PICU, and then after going through the treatment there, they came down to the regular floor, which was my unit, and I took care of the child after the PICU, and he was still alive, but there was this large concern that they thought the child was now blind and deaf
yeah,
from
yeah.
the meningitis. And I remember, as an intern, talking to the parents and doing the transfer admission note and listening to their sorrow for not having the Prevnar vaccine.
Mm.
The outcome of their child would have been completely different. But that was like a very, I wasn't a parent yet, but that was a hugely impactful experience that I went through very early into my pediatric training. Right.
That and stories like it are so sad, and they remind me of the quote that most people know, those who cannot remember the past are condemned to repeat it, which was by philosopher George Santayana, because if we stop vaccinating, these diseases will come back.
Yeah. And I feel like this day and age, with all these vaccines being on the routine immunization schedule, people are forgetting how scary these diseases actually were once upon a time. Without the full understanding, maybe a knowledge of how fearful parents used to be about these diseases.
Yeah, and about fever,
Yeah.
right? Because fever could be the only symptom of these more serious infections that we now prevent with vaccines. In the second half, let's turn our attention to pertussis, or whooping cough, which is the P in the diphtheria, tetanus, pertussis vaccine, or the DTaP vaccine, also given in infancy and then again as boosters later in life.
We should talk about whooping cough because, again, this is one that, um, was pretty much gone, but we'd see a young baby here and there just because it's still out there, right? And it is so scary. I remember being on the sixth floor in the dark room and the kid just going, and turning the pulse box going down. It, those are very scary patients to have in the hospital. Very scary. And it's scary for parents because their kids literally, like, you think a breath holding spell is scary when you have your kid having his tantrum, he screams, he goes, ah, turns blue, and then maybe pass out. This is like that to the 10th degree, right?
Yeah.
Because these little babies just literally stop breathing, and it is so awful. But that's just like one piece of it, because it's called 100-day cough, right? Literally, even adults can cough for 100 days. How many parents come back to our office like the second week of the viral illness saying he's still coughing? I'm like, yes, he is still coughing. 100 days, right?
100 days.
That's a long time. That's a lot of coughing. So it is really, really a very bad illness. But giving this to pregnant moms is enormously important. And to pass these antibodies onto their babies before they can get to their 2-month shots, because that's the biggest risk for them. And it's been huge. I mean, there's a lot fewer babies with pertussis whose moms are vaccinated now, and it makes an enormous difference.
Yeah.
These are things that scare us, like you described. They scare us as pediatricians.
I'm known as the calm guy. There are very few things, like, I'm totally calm. All the residents are like, I'm like, it's all going to be fine. But these are the things that, like, these are memories we have from 30 years ago, from 20 years ago, that never leave you. And I can tell you, my dad has memories from 50 years ago of things that scared him, right? These things it stays within our community of pediatricians because none of us want to be dealing with these things. None of us want to take care of the meningitis kid. It's awful. It's a terrible experience, and there's nothing worse than, you know, coming out of the ER room or the ICU and telling a parent that their child passed away. That
Oh, it's
none of
awful.
us, all of us have done that,
Yeah.
and
Yes.
none of us like to do that or want to ever do that. What's so hard to get people to understand is the reason why we don't see these things is because of the vaccine, right?
Yes.
It's like you don't experience it, you don't hear about it, you don't talk about it. There's a reason for that. It's because
Yes.
of successful vaccine programs, which have taken years to put in place, right?
After Dr. Krugman said that, I was reminded of a post I actually saw on social media just this past week that was promoting misinformation about vaccines. And the post said something along these lines. Between the years 2000 and 2010, 10 children died following the measles vaccine. In that same decade, only 2 children died from measles infection. So isn't it obvious the vaccine is more dangerous than the disease? This was the claim that the post was making. Okay, so on first glance, I admit, like, I had to take a step back and it sounds very alarming. Like, it strikes fear. It's meant to strike fear. Social media algorithms love to promote fear. But when I take a step back and really look at this, I realize how incredibly illogical this argument is. So, okay, first of all, let's take the first part of that statistic. 10 children dying following a measles vaccine over a 10-year period of time in which millions of doses were given is within the number expected for the 2 events to occur in time coincidentally of each other. In other words, that doesn't imply causality, that the measles vaccine caused the deaths. Anytime anything like that is reported in VAERS, the vaccine reporting system we discussed in our Vaccines 101 episode, it's investigated. However, let's take the flip side of this argument. To claim that only 2 children died of measles during that same time period is absurd, because only 2 children died of measles in that decade because no one was getting measles.
Right.
In fact, measles had been declared eliminated in the year 2000, with only a few cases occurring throughout the years following. So this is an example where the success of the vaccine, as in the success of the measles vaccine preventing measles, is actually being used as evidence against the vaccine, as in there were no deaths from measles, so why should we be worried about measles? Of course there were no deaths from measles because nobody was getting measles. And again, it's such a twisting of information and the way it's presented. The vaccine had proven measles to be practically eliminated during that decade. And that's the point Dr. Krugman is getting at when he says it's hard for people to understand that the reason we aren't seeing the disease is because of the vaccine. Well, measles is highly contagious. We talk about that in another episode. And because of that, herd immunity only works when the measles vaccination rate is in the high 90%.
You can try to skate by on herd immunity, but the more that herd immunity goes down, the likelihood of skating by goes down as well.
So think of herd immunity in terms of a wildfire. If enough people are vaccinated, or are inflammable in this analogy, the fire starts and then it dies out because it doesn't have anywhere else to catch fire. If enough people are unvaccinated or flammable, the fire or disease spreads like wildfire, pun intended. Children who are not vaccinated are mostly being protected by herd immunity. In another episode, we talk about measles outbreaks being the bellwether, like the check to warn us that our shield of protection from herd immunity is starting to break down. So the more a person who does not vaccinate their children encourages other people to not vaccinate their children, the more they are putting their own child at risk.
Yes.
You know, we didn't ask you, if you're okay with this, do you have children and did you vaccinate them?
Oh, yeah. So I have 2 boys who are grown, and they not only have gotten every possible childhood vaccine, but I make them get their flu shots and their COVID shots every year, and they're still getting vaccinated. So even though they're 26 and 23, they're still vaccinating.
just to really drive home the point that we do practice what we preach. Absolutely.
We do.
Absolutely. So as we've listened to this interview, I want to leave you with a few concluding thoughts. As professionals who have spent decades taking care of children, and as parents raising our own children, we want you to know that we absolutely feel vaccines are safe and the risks of not vaccinating your children far outweigh any possible side effect associated with vaccines.
Well, we support more research being done on vaccines. We have to do that acknowledging the risk that each of these infections poses to an infant or young child, as well as while acknowledging the studies that have already been done, some involving hundreds of thousands of children that have showed no difference in rates of autism between vaccinated and unvaccinated children.
You know, in addition, we have the Vaccine Adverse Event Reporting System, or VAERS, and the Vaccine Safety Data Link, or VSD, which we talked about in more detail in Vaccines 101. And these systems report and investigate any type of vaccine adverse event that we may not already know about. That is the way we monitor the safety of vaccines. It is our firm recommendation that immunizing your child according to the American Academy of Pediatrics, or AAP guidelines, is one of the most important things you can do to protect your child's health. You've been listening to one part in our vaccine series. If it is helpful, please listen to our other episodes for a more complete picture of vaccines. We encourage you to continue this discussion with your primary care provider. I want to thank Dr. Krugman for being our special guest on today's show. Thank you for listening.
This is 10 Kids, 2 Docs. I'm Dr. Vivian Carlin.
And I'm Dr. Sylvia Bank. We'll see you next time.
See you next time.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.